In 2007, the University of Maryland celebrated the opening of a new School of Public Health on the College Park campus. The vision for our school was to leverage and build upon the diverse strengths of the University of Maryland, a national powerhouse in research and academics, so that we could tackle the state's most pressing public health challenges and improve the lives of Marylanders.
To have a university with a School of Public Health on its campus means we have greater reach in really addressing the land-grant mission of our institution. So we are the only School of Public Health at a state institution in Maryland. We are Maryland's School of Public Health. And our hope as a school is to not only make a difference here where we live, but to also make a difference in the region and across the nation.
Our research spans from the cellular to the societal level and is making a difference in critical areas, from understanding climate change's impact on health to physical activity's benefits to aging brains, to preventing cancer through community-based interventions, and much more. Our school's heritage dates back more than a century and is built upon strong expertise in kinesiology, as well as family science and behavioral and community health. Our school applies these strengths in all the other traditional public health disciplines, including environmental health, epidemiology, and biostatistics, and health services, to translate research into healthy policies and strategies to promote and prolong health throughout the lifespan. Our partnerships have enabled us to play a role in transforming health systems to better meet community needs, whether right here in Prince George's County, in our state's rural communities, or across the globe. Our location, just a short metro ride from the nation's capital, gives us access to leading health research, policy, and advocacy organizations, at which our students can gain unparalleled hands-on experience and a competitive advantage. Our undergraduate student body has grown more than 60%, and we have nearly doubled our graduate students since 2007. We are now educating a dynamic and diverse student body of more than 2,400 undergraduates and 400 graduate students who will be the next generation of public health professionals who are fearlessly promoting health for all. With a strong commitment to advancing health equity and social justice, our school is proud of our students who are discovering new knowledge and applying it in innovative ways to transform communities and save lives.
Public Health Without Borders is a mostly student-run organization that focuses on reducing disparities across the world in countries such as Peru, Ethiopia, Sierra Leone, and India. We create health education materials through the partnerships with the communities, and we focus on maintaining sustainable partnerships within the community so that we can keep feelings of trust and reciprocity so that everyone can benefit more.
So I chose the Master of Public Health and Health Equity because it is a very unique program. You won't find another one like it in the nation. And I have the opportunity to be mentored by experts in health disparities. With my training so far with the master's program, I was able to apply and secure a grant with the National Cancer Institute that allowed me to go to Tanzania, where 80% of cancer patients are suffering from cervical cancer. My role there was to assess the barriers, fears and knowledge of cervical cancer to women who had not followed up and gotten treatment. And my hope is to use that information to influence some type of intervention, change in communication between patient and providers, or a change in policy with the hospital.
As a doctoral student, I've had the unique opportunity to experience conducting a research project with funding from the Defense Advanced Research Project Agency. And incredibly, I've been able to be involved through the entire research process. This opportunity has really afforded me a chance to work with leading experts in respiratory disease infection and built environment. We work with an interdisciplinary team of researchers, engineers, biostatisticians, and immunologists and virologists.
This innovative and interdisciplinary approach comes to life in many of the activities of our school's leading research centers. The Maryland Center for Health Equity and the Herschel S. Horowitz Center for Health Literacy both play a critical role in bringing together diverse fields and sectors to eliminate health disparities and improve access to health information.
Health disparities are not simply differences in the incidence and prevalence rate of disease. Health disparities are actually caused by systematic discrimination, racism, social isolation, the conditions beyond medical care that actually contribute to poor health outcomes. We were actually able to get a law passed called the University of Maryland School of Public Health, Center for Health Equity, Health in All Policies. And this law, which was signed by the governor, requires all of the secretaries in his cabinet to sit around the table and look at how their policies impact health.
If you think about it, pretty much every aspect of public health has an element of public information and communication. There's very little that we do in public health that isn't about taking that information and sharing it in some way with others. So if you think about collecting data about an infectious disease outbreak in a community, the reason we collect that data is so that we know what's going on and we can share that information with the relevant public officials, with the relevant clinicians, with the members of that community so that they can take action to protect their health. That's health literacy in action, because the data would not be nearly as useful if we didn't have a way to communicate it to the people who could take action.
I'm proud to be part of a team leading the School of Public Health in this bold endeavor that requires us to think big, to collaborate across disciplines and sectors in support of achieving the public health goals of our nation. 10 years since our founding, we can celebrate our contributions to promoting and protecting health for all and envision the impact we want to have in future decades. Working together, we look forward to the next 10 years, to implementing a new strategic plan that looks at the globe, that looks at the community, that looks at the needs of the state of Maryland, and continues to educate the leaders of our state and beyond.